Hi, I'm Stephanie Craddock, the Simulation Coordinator at the Wells Center, and I wanted to take this opportunity to spend about a minute or two going over some of the CLABSI elements that we included in your simulation experience with us this year. If you were adhering to that CLABSI bundle, you would have noticed that we included a physician order with every central line so that you could properly flush. We noticed that you adhered to good hand hygiene and really prioritized having gloves on anytime you provided any central line maintenance or care. When you were assessing the IV tubing, most of you even noticed that we did not include curos on the caps of his central line or the ports of that IV tubing. And so you made sure that a curo was on each one of those ports. When you were assessing your IV tubing, you probably even noticed that we had looped tubing, which is never something that you want to infuse through. So you made sure that you got fresh, new, sterile tubing before you infused any medications or saline through it. When you were assessing that central line, most of you even noticed that that tegaderm wasn't adhering to his skin and looked pretty loose. So you prioritized making sure that you did a good, sterile central line dressing change using our new central line kits, and even made sure that you got a bio patch. You also received blood culture orders, 2 to be specific. Many of you even prioritized getting a peripheral stick for that first blood draw, which is a huge priority for accuracy. And when you drew through that central line for those blood cultures, you changed those caps and you made sure that you didn't flush or even waste any blood. One of the other priorities that we noticed is you made sure that you put that blood in their correct order, meaning you filled that green lab tube and then the aerobic lab and then the anaerobic. So you went in a specific order: green, blue, purple. Green Bay Packers is a good way to remember that. You even made sure that each tube and bottle was filled correctly, meaning that green one had at least 1 to 2 mLs of blood, and that aerobic and anaerobic had at least 10 mLs of blood, which is a huge priority for blood cultures. I wanted to thank you for the care that you provided our patients during your simulation experience. I know patient safety is a priority, and I'm happy that you were able to watch this video and prioritize our CLABSI bundle.